Center test prep exam dumps. Question 1. What is the classic sign of a basilar skull fracture? Option A, Battle's sign, mastoid ecchymosis. Option B, rhinorrhea with glucose-negative fluid. Option C, hemotympanum. Option D, all of the above. The correct answer is option D, all of the above. Classic signs of basilar skull fracture include Battle's sign, postauricular ecchymosis, raccoon eyes, periorbital ecchymosis, hemotympanum, blood behind the tympanic membrane, and CSF leak, rhinorrhea or otorrhea, which tests positive for glucose. Question 2. A patient presents with costovertebral angle tenderness, fever, chills, and dysuria. The nurse suspects. Option A, cystitis. Option B, pyelonephritis. Option C, nephrolithiasis. Option D, renal artery stenosis. The correct answer is option B, pyelonephritis. Pyelonephritis is an upper urinary tract infection characterized by systemic symptoms, fever, chills, and CVA tenderness, distinguishing it from lower tract cystitis. Question 3. The emergency nurse suspects acute epiglottitis in a patient presenting with option A, inspiratory stridor, drooling, and tripod positioning. Option B, barking cough, low-grade fever, and hoarseness. Option C, productive cough, pleuritic chest pain, and fever. Option D, wheezing, prolonged expiration, and accessory muscle use. The correct answer is option A, inspiratory stridor, drooling, and tripod positioning. The classic triad of epiglottitis includes inspiratory stridor, drooling, from inability to swallow, and the tripod position, leaning forward on hands. This is a life-threatening airway emergency. Question 4. Hepatitis is primarily transmitted via option A, blood and body fluids. Option B, fecal-oral route. Option C, sexual contact. Option D, contaminated needles. The correct answer is option B, fecal-oral route. Hepatitis is transmitted primarily through the fecal-oral route, often through contaminated food or water. Hepatitis B, C, and D are bloodborne. Question 5. A patient with anaphylaxis develops acute respiratory distress, wheezing, and hypotension. What is the priority medication to administer? Option A, albuterol nebulizer. Option B, intravenous diphenhydramine. Option C, intravenous corticosteroids. Option D, intramuscular epinephrine. The correct answer is option D, intramuscular epinephrine. Epinephrine is the first-line and most critical treatment for anaphylaxis. It provides both alpha, vasoconstriction, and beta, bronchodilation, effects. Administration into the anterolateral thigh is the preferred route. Question 6. A patient with a history of atrial fibrillation who is not on anticoagulation presents with acute onset right leg pain, pallor, and absent pulses. The nurse suspects. Option A, deep vein thrombosis. Option B, acute arterial occlusion. Option C, cellulitis. Option D, compartment syndrome. The correct answer is option B, acute arterial occlusion. The sudden onset of the 6ps pain. Question 7. To calculate cerebral perfusion pressure, CPP, the nurse needs to know. Option A, heart rate and blood pressure. Option B, mean arterial pressure, MAP, and intracranial pressure, ICP. Option C, respiratory rate and oxygen saturation. Option D, central venous pressure and cardiac output. The correct answer is option B, mean arterial pressure, MAP, and intracranial pressure, ICP. CPP equals MAP, ICP. A normal CPP is 60 to 80 mmHg. Maintaining adequate CPP is critical to ensure cerebral blood flow in patients with elevated ICP. Question 8. A patient presents to the emergency department with a laceration that requires sutures. During the procedure, the patient states they feel faint. The nurse's first action is to option A, administer oxygen. Option B, place the patient in Trendelenburg position. Option C, immediately discontinue the procedure. Option D, assess vital signs. The correct answer is option C, immediately discontinue the procedure. The nurse should instruct the provider to immediately stop the procedure to reduce vagal stimulation and prevent syncope. After the procedure is stopped, the patient can be placed supine and assessed. Question 9. Which of the following is the priority assessment when a patient is found to have rhabdomyolysis? Option A, neurological status. Option B, renal function and urine output. Option C, skin integrity. Option D, cardiac rhythm and rate. The correct answer is option B, renal function and urine output. Rhabdomyolysis involves the breakdown of muscle tissue, releasing myoglobin into the bloodstream. Myoglobin can precipitate in the renal tubules, causing acute kidney injury. Monitoring urine output and renal function is critical. Question 10. Which of the following is a sentinel event that requires reporting to the Joint Commission? Option A patient fall that results in a minor abrasion. Option B, a medication error that causes no harm. Option C, surgery on the wrong body part. Option D, an armor discharge. The correct answer is option C, surgery on the wrong body part. Sentinel events are serious, unexpected occurrences involving death or serious physical or psychological injury, or the risk thereof. Wrong site surgery is a classic example that requires root cause analysis and reporting. Question 11. The most effective method to control severe bleeding from an extremity wound is: Option A, elevation. Option B, direct pressure. Option C, pressure point compression. Option D, ice application. The correct answer is option B, direct pressure. Direct, firm pressure applied to the wound is the most effective initial method for controlling severe external hemorrhage. Tourniquets may be used if direct pressure fails. Question 12. The best method to remove a prosthetic eye in an emergency is: Option A, using forceps to grasp the prosthetic. Option B, applying suction with a bulb syringe. Option C, using a suction cup designed for prosthesis removal. Option D, sweeping a finger around the edge to break the suction. The correct answer is option C, using a suction cup designed for prosthesis removal. A small suction cup designed for this purpose is the safest method. Alternative methods can damage the prosthesis or the surrounding tissue. Question 13. Which laboratory value is most indicative of acute kidney injury? Option A, elevated white blood cell count. Option B, elevated creatinine and BUN. Option C, decreased platelet count. Option D, elevated liver enzymes. The correct answer is option B, elevated creatinine and BUN. Elevated serum creatinine and blood urea nitrogen, BUN, are the hallmark lab findings of acute kidney injury, reflecting decreased glomerular filtration rate. Question 14. A patient presents with cramping abdominal pain, distension, vomiting, and high-pitched tinkling bowel sounds. These findings are most consistent with: Option A, gastroenteritis. Option B, bowel obstruction. Option C, irritable bowel syndrome. Option D, acute pancreatitis. The correct answer is option B, bowel obstruction. The classic presentation of a small bowel obstruction includes cramping pain, abdominal distension, nausea/vomiting, and early high-pitched, hyperactive bowel sounds, borborygmi, that become absent later. Question 15. A patient is brought in with decreased consciousness after being found outside in cold weather. Core temperature is 30 degrees Celsius, 86 degrees Fahrenheit. What ECG change is the patient most at risk for? Option A, atrial flutter. Option B, prolonged QT interval. Option C, Osborne, J, wave. Option D, ST depression. The correct answer is option C, Osborne, J, wave. The Osborne or J wave, a positive deflection at the J point, is a characteristic ECG finding in moderate to severe hypothermia and becomes more pronounced as temperature decreases. Question 16. A Cole's fracture involves the: Option A, proximal humerus. Option B, distal radius. Option C, femoral neck. Option D, tibial plateau. The correct answer is option B, distal radius. A Cole's fracture is a fracture of the distal radius with dorsal angulation, usually from a fall onto an outstretched hand, foosh. Question 17. A patient presents with severe epigastric pain radiating to the back, nausea, and vomiting. The nurse notes ecchymosis around the umbilicus. This finding is known as option A, Gray-Turner sign, option B, Cullen sign, option C, Murphy's sign, option D, Rolfsing sign. The correct answer is option B, Cullen sign. Cullen sign, periumbilical ecchymosis, and Gray-Turner sign, flank ecchymosis, indicate retroperitoneal hemorrhage, classically associated with hemorrhagic pancreatitis. Question 18. A patient with acute respiratory distress has the following arterial blood gas: pH 7.22, PaCO 258, PaO 262, HCO 324. This represents option A, uncompensated respiratory acidosis, option B, compensated respiratory acidosis, option C, uncompensated metabolic acidosis, option D, compensated metabolic acidosis. The correct answer is option A, uncompensated respiratory acidosis. The low pH, acidosis, with elevated PaCO2, respiratory component, and normal HCO3, no metabolic compensation yet, indicates an acute, uncompensated respiratory acidosis. Question 19. The most common cause of airway obstruction in an unconscious patient is option A, laryngospasm, option B, foreign body aspiration, option C, the tongue, option D, mucosal edema. The correct answer is option C, the tongue. In an unconscious patient, loss of muscle tone allows the tongue to fall posteriorly and obstruct the airway. The jaw thrust or head tilt forward/chin lift maneuver is the initial intervention. Question 20. A patient with a pulmonary embolism is at highest risk for which immediate complication? Option A, pulmonary fibrosis, option B, right ventricular failure, option C, left ventricular hypertrophy, option D, atelectasis. The correct answer is option B, right ventricular failure. A massive pulmonary embolism increases pulmonary vascular resistance, which can cause acute right ventricular strain and failure, acute cor pulmonal, due to the increased afterload on the right ventricle. Question 21. A patient bitten by a rattlesnake develops severe pain, swelling, and ecchymosis at the site. The priority intervention is option A, application of ice to the bite, option B, incising and suctioning the wound, option C, application of a tourniquet proximal to the bite, option D, administration of antivenom, crotalidase. The correct answer is option D, administration of antivenom, crotalidase. The definitive treatment for significant pit viper envenomation is antivenom. Outdated first aid measures, ice, incision forward/suction, tourniquet, can worsen tissue damage. Question 22. A patient presents with cholinergic symptoms, salivation, lacrimation, urination, defecation, GI upset, emesis, meiosis. This toxidrome is most likely caused by option A, anticholinergics, option B, sympathomimetics, option C, cholinergics, organophosphates, option D, opioids. The correct answer is option C, cholinergics, organophosphates. The classic SLUGM, salivation, lacrimation, urination, defecation, GI upset, emesis, meiosis, presentation is the cholinergic toxidrome, caused by organophosphate or carbamate poisoning. Question 23. Which ECG finding is most indicative of hyperkalemia? Option A, prolonged QT interval, option B, peak T waves, option C, ST depression, option D, delta waves. The correct answer is option B, peak T waves. Peaked, narrow, symmetrical T waves are a classic early ECG sign of hyperkalemia. As potassium levels rise further, P waves flatten, the PR interval prolongs, and eventually the QRS widens into a sine wave pattern. Question 24. A patient presents with a chemical eye splash. What is the priority nursing intervention? Option A, patch both eyes. Option B, immediate copious irrigation with water or normal saline. Option C, administer topical antibiotic drops. Option D, perform a visual acuity test. The correct answer is option B. Immediate copious irrigation with water or normal saline. Immediate and prolonged irrigation of the affected eye to dilute and remove the chemical is the single most critical intervention to prevent permanent corneal damage. Irrigation should precede any other assessment. Question 25. The priority patient for a trauma team activation based on mechanism of injury is option A. An adult who fell from standing height. Option B. A pedestrian struck by a car traveling 15 miles per hour. Option C. An adult ejected from a vehicle. Option D. An adult with a gunshot wound to the forearm. The correct answer is option C. An adult ejected from a vehicle. Ejection from a motor vehicle is a high-risk mechanism of injury that alone warrants trauma team activation and comprehensive evaluation, regardless of initial vital signs.